Hello and Assalamualaikum. I'm Farhah Adlina binti Zamari, KIB 190014. Congenital adrenal hyperplasia causes mainly from mutation in the type of gene that codes for one of a few enzymes that are responsible in making steroid hormones. The most common enzyme to be affected is 21-hydroxylase, which is a key regulator in synthesizing stress hormones cortisol. In around 2/3 of affected individuals, the enzyme defect in the adrenal may also affect the production of aldosterone, which functions for retaining salt in the body. Single mutation in the gene that codes for 21-hydroxylase are very frequent, as it affects 1 in 50 people in the overall population. Some of the factors that contribute to the mutation includes external influences such as exposure to specific chemicals or radiation and causes DNA breakdown. Furthermore, mutation can also occur if DNA fails to copy accurately and causes error during DNA replication. There are a variety of mutations, some of which severely affect enzyme activity and others who only have minor effects. So, there are a variety of severities in this condition. Genetical offspring is also one of the factors that contribute to this disease. However, congenital adrenal hyperplasia is a recessive disorder, which means that mutation must be inherited from both parents in order to develop the condition. As a result, approximately 1 out of 12,000 babies will be born with congenital adrenal hyperplasia. In patients with congenital adrenal hyperplasia, the body acknowledges the insufficient level of cortisol and therefore it will try to stimulate the adrenal gland to produce exact levels of cortisol for the body. However, there is an enzyme defect, so the body will fail to produce cortisol and instead it will produce excess amounts of precursor steroid. These precursor steroids are mostly androgenic, that is similar to the male hormone testosterone. And excess amounts of male hormone will lead to development of male characteristic and early puberty. A fetus that is born with congenital adrenal hyperplasia will release excessive amounts of male hormones during development. If the fetus is female, the abundance of male hormone will result in virilization of external genitalia, where they will look more masculine. Or the female baby may also be born with ambiguous genitalia, whereas from the appearance of external genitalia, it is unclear to see whether the baby is female or male sex. Mutations or partial deletions that affect the gene that codes for 21-hydroxylase are very common, with estimated frequencies as high as 1 in 3 individuals in selected population and 1 in 7 individuals in New York City. The estimated prevalence is 1 case per 60 individuals in general population. Classic adrenal hyperplasia has an overall prevalence of 1 case per 16,000 population. However, in selected populations such as in U-Peak of Alaska, the prevalence is as high as 1 cases per 400 population. Congenital adrenal hyperplasia caused by 11-beta-hydroxylase deficiency accounts for 5% until 8% of all congenital adrenal hyperplasia cases.
Now I'm about to explain to you the mechanism of CAH. An individual who suffers from CAH usually lacks of the enzyme hydroxylase, which is used to convert progesterone to aldosterone and 17-progesterone to cortisol. So, aldosterone is necessary for normal retention of sodium by the kidney, whereby its absence will cause salt loss. On the other hand, cortisol regulates body response towards illness and stress, which lacks of it, if we lack of cortisol, it will cause adrenal failure. So now, what happens if the body lacks of 21-hydroxylase? It will then cause buildup for these two precursors right here, progesterone and 17-hydroxyprogesterone, which then they will be shunted into an alternate pathway to produce adrenal androgens, which will then cause excessive androgens in the body and resulting to abnormal sexual development, which includes virilization of female fetuses and precocious puberty. Besides that, aldosterone and cortisol deficiency also cause the patient to suffer from progressive weight loss, vomiting, dehydration, hypotension, hypokalemia, and weakness.
Hello and Assalamualaikum. My name is Nurfati Atira, and today I'm going to explain the current treatments that are available for this disease. Treatments for this disease often included surgery, medication, and psychological support. Psychological support is important, especially in females that may have identity crisis due to the nature of their disease. People with classical CAH start their treatment since infant to minimize the effects of the disease. To replace low hormones that are provided with steroids, children take a form of cortisone called hydrocortisone, while adults take hydrocortisone, prednisone, and dexamethasone, which also replace cortisone. They also need to wear a medical alert bracelet or necklace to notify medical practitioners in case of emergency. Patients with classical CAH are required to take their medications throughout their life. Their immediate relatives need to learn to inject the hydrocortisone in case of dire need. Female patients may need surgery for the external genitalia as their urine flow can be disrupted due to the abdominal structure of the genitalia. Patients with non-classical CAH may not need treatment if the symptoms, which is early puberty, excess body hair, irregular menstrual periods, and infertility, do not rise. Those with symptoms are given the same hormones as patients with classical CAH, but a lower dose, non-classical, but with a lower dose. Non-classical CAH patients may stop their medications as adults if their symptoms go away. They do not need surgery as their genitals are normal.
Hello and hi. After hearing about all the treatments that we've been used to treat patients with CAH, now we are going to talk about the limitation of the current treatments, which is in terms of medication and surgery. First of all, one of the limitations of the current treatment is it does not have an optimal dose of glucocorticoids and mineralocorticoids in the adult stage. This is because the body makes different amounts of cortisol at different times in life. So, sometimes a patient dose of medication may be too high or may be too low. A proper treatment with glucocorticoids eventually can reduce the stimulation of the androgen pathway, thus preventing the virilization and allowing normal growth and development. However, the thing we are talking about is the limitation of the current treatment, which is when there is a situation where an overdose of glucocorticoids, this can lead to iatrogenic of depression syndromes, whereas an other dose of glucocorticoids can lead to the chronic adrenal insufficiency, while the overdose mineralocorticoids can lead to the hypertension. This is because a large-scale randomized control study to determine the optimal dose of glucocorticoids and mineralocorticoids in the adult stage has not been performed. Okay, apart from that, the one who live with the patients with CAH need a specialty to handle the medication during emergency. This occurs in non-life-threatening periods of illness or physiologic stress. The corticosteroid dose should be increased to 2 or 3 times of the maintenance dose for the duration of that period, divided into 3 daily doses. Each family should be given injection kits of hydrocortisone with the brand name of Solcortef for emergency use, and all family members should be trained to use the injection kit. This kind of method really or quite difficult for a certain family to learn new things and to handle this kind of medication. go through on how the hydrocortisone is being taken by the CAH patients. First of all, hydrocortisone injection is available as a brain name drug Telcortel. So the patient is taking hydrocortisone via intramuscular injection or orally, and is taken since an early stage. The issue is this might not be a very pleasant way of delivering drug because it has a few side effects, which are increased risk of infection warning, live vaccines warning, adrenal insufficiency warning, and Cushing syndrome warning, which may cause symptoms of Cushing syndrome like weight gain, slow growth, straight march, rounded face, and also high blood sugar. So we are taking into account on the improvement treatment by taking form of hydrocortisone via transdermal microneedle patch. It is easier to handle, especially for children, and there are a few advantages, which are avoid the first pass effect of the metabolism associated with the oral route. Therefore, the transdermal administration allows the improve of bioavailability. Next, allows prolonged release of certain medication, which can improve the patient adherence. And lastly, minimize adverse effects due to lower drug peak concentration. So, by mentioning all of these limitations of the current treatment, we are going to improve the treatment with a better solution or a better treatment to make sure that the CAH patient can be cured in the best way.
It's Ramazan Alisaini, and I'm going to present about the improvement in treating congenital adrenal hyperplasia. So the current treatment, as we know, is taking a form of hydrocortisone via IM injection, oral medication, or even IV injection. So this is taken since an early stage, and it's not really a comfortable way of delivering drug, especially among children and at young age. So the improvement I've been suggesting is by taking a form of hydrocortisone via transdermal microneedle patch. So it is obviously better than oral medication, and how it works is by having the microneedle patch attached to our skin, and it will undergo systemic absorption via the dermal microcirculation. So this is actually easier to handle and better to avoid first pass effects, which is the effects where the drugs wear off or decreases by the time it arrives in our bloodstream. So there are a few things that must be taken into consideration. Firstly, the property of hydrocortisone. So hydrocortisone is a hydrophobic compound, which is a really suitable compound to be used via transdermal drug delivery system. Second, the time of action. So actually, transdermal delivery system take about 24 hours to take effect, but by application of microneedle, it will shorten the time to about only 20 minutes, which is a good enough time for the drugs to take its action. Also, actually, I think it's a very good alternative method instead of taking injection and also oral medication. Thank you, that's all from me.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aiskan Nabi Yusri, and I will summarize everything about our case study, which is known as congenital adrenal hyperplasia. So I'm just want to summarize everything that my friends just presenting about everything about limitations, the treatments, and also the introduction. So in contrast, we know that CAH always related with some of the devices of these two components, which is known as the lacking of the cortisols and also lacking of the 21 hydroxylase. So basically what happens, the procedure. So the procedure is just, I want to simply explain to you. So when the body lacks of producing the cortisol, which is the adrenal gland, the body fails to stimulate the adrenal gland to produce the cortisol. So what will happen? So afterwards, it will, instead of producing the cortisol, the body itself produce the precursor steroid. So in the precursor steroid, it will develop any type of male properties to the patient itself, the condition itself. So we should know that there is also a genetic hormone, the genetic growth, the extra hair is also come with as the side effects. So okay, furthermore, there is also explaining about there is two types of the CAH. So the first one is classical CAH, the second one is the non-classical CAH. So in CAH, in the classical CAH, there is treatment needed for the kids and also the adult. However, for the non-classical CAH, there is no treatment needed if there is no symptoms involved. Okay, so let's move on. In our case study, we know that CAH is an inherited genetic disease. So when it comes to inherited genetic disease, we all should know that every of our family tree, you can also diagnose it in early time to avoid or to prevent this type of issues. Okay. However, put your worries away. Okay, CAH is not bad as you think. If we take an extra care of our adrenal glands, never put it too much stress on it, then we should be able to live fine as a normal person. Okay. So examples included as the the extra care of treatment. It includes as surgery, where the injuries. We need to prevent all of that in our adrenal glands, because if these adrenal glands are being stressed over, then it will be jammed to our life. Okay. So in addition, your blood glucose is also should be in a controlled way, whereas there is some condition when people being so active, there's so many glucose needed. When many glucose needed, energy is provided. So this is when the adrenal glands will have some type of problems with it. And also when you're fasting, the Muslim itself fasting in the middle of the day, okay, this might cause the blood glucose to drop. Okay, and this, however, to prevent this is much easier. There's increase of intake of glucose and carbohydrates, then should be not a problem. Okay, and so many question rises is CAH able to be treated or not? Okay, need to be put in mind that CAH is a lifelong condition. When I tells you that CAH is from the genetic inherited disease, so we know that it's not really unable to cure, but we can cure it by maintaining the process. So, however, if you have the correct treatment, either medical or surgeries, like the outlook will be mainly good. The outlook will be mainly good to positive result. And also, if you are a woman with a genital abnormality, like genital abnormality, like such as the human growth, the abnormality growth of the woman itself, that you have extra muscles, extra hormones, steroid hormones, like that. This might go wrong with your sexual adjustments. So this is also caused by you may not be able to grow very tall like every girls, normal girls. This always occurred to the early stage of the female. So I think that is just summing up everything related with our case study, congenital adrenal hyperplasia, which is CAH. Okay, so just need to be taken as advantage, or just need to be taken as more info that CAH is not bad as you think, but as long as you following the procedures, following the treatment needed, everything should be fine. That's all for me. Thank you very much.